Hello friends, in this video we will discuss PIB article summary for the articles published on 1st Feb 2018. These articles are important for RBI Grade B and NABARD Grade A and Grade B 2018 exams. We have two topics for discussion. The first one is GOBBON Scheme and the second one is Ayushman Bharat Scheme. So these both of scheme have been announced in the budget 2018 by the government. So let us discuss these schemes in detail. First we have GOBBON Scheme. Here the term Gobbar means galvanizing organic bio-agro resources, then Dhan. So this is the Gobbar, galvanizing organic bio or agro resources, which is basically to help the rural areas, and the aim of scheme is to make the villages open defecation free. Under this scheme, what will be done that the waste from cow dung will be processed and it will be converted. So it is basically to manage and convert cattle dung and other solid waste present in the rural farms, and those will be converted into different useful products which could be utilized in agricultural sector itself. For example, it can be used for making the compost. We can generate biogas from the agricultural waste and the cow dung. Similarly, bio-CNG can also be made via this proper utilization and conversion of these waste products. So these are the various useful products that can be formed from the wasteful cow dung and the other solid waste generated in the farmlands. And this will not only provide address the issues of open defecation. Besides, it will also address the issue of solid waste management or sewage management to some extent. Besides, it will provide it will be helpful for the environment. And it will also provide economic opportunities for the rural communities to pursue their careers in this field, to generate and sell and utilize these useful products for different sectors. For example, this can be utilized in agriculture as well as in fertilizer sectors or industries. So these are the various benefits which can be derived from processing of agricultural waste, which is being targeted through this GOBBON scheme. Next we have Ayushman Bharat Scheme. This scheme has been announced in the budget 2018 under the health budget, you can say. So the basic objective of this scheme is to focus on wellness of poor families. So this scheme is mainly to address the concerns related to health sector for the poor families, and to provide the medical facilities and medical benefits to the poor families. So this particular program has two components. The first one is called health and wellness centers, which is basically envisaged in the National Health Policy 2017, and it has been envisaged as the foundation of India's health system. Under the scheme, 1.5 lakh health and wellness centers will be created across the country, and this will provide a comprehensive health care, including cure as well as prevention and promoting wellness among the communities. So basic aim is of these healthcare centers is not only to provide curing medicines to the patient, but also to promote wellness and healthy living among the communities in order to reduce the burden on the health issues. So it will have comprehensive healthcare system and will include non-communicable diseases, maternal death issues, and child health services, etc. These centers will also provide free essential drugs to the patients and free diagnostic services to a certain extent. The budget has been allocated, so the budget allocated for this component is rupees 1200 crore for this particular component, and the contribution from private sector has been invited in this sector in implementation of this scheme through CSR, that is corporate social responsibility funds, and other philanthropic institutions in adopting these centers in order to provide or improve the health services. The next component under this scheme is called National Health Protection Scheme, which is basically an insurance scheme to provide health insurance coverage to around 10 crore poor families, and the coverage is up to rupees 5 lakh rupees per family per year, and it will be for secondary and tertiary care hospitalization. So benefits will be available for tertiary and secondary care hospitalization, and it will be world's largest government program that will be aimed to ensure the health insurance or health care among its public. For this also an amount has been allocated, a good amount has been allocated for this particular component of health insurance scheme under the health budget for budget 2018. Other than these two, this scheme under the Ayushman component, other initiatives are being taken under health budget by the government. For example, rupees 600 crore have been allocated for nutritional support to all TB patients, and it is basically to improvise the TB care and to reduce the number of TB patients, new as well as to ensure that there is proper cure of TB patients through various medicines available, and to reduce the multiple drug resistance that is currently prevalent in the country among the TB patients especially. These schemes are also aimed to generate jobs and with special focus on women, so it will also help to meet the employment targets for the government also. Another initiative taken by the government is that it has proposed that there should be at least one government medical college and hospital for every 3 parliamentary constituencies to enhance the accessibility of quality medical education and health care. Currently 24 such government medical colleges and hospitals will be set up, and it can be by upgrading the existing district hospitals in the country. Therefore it will have that at least one medical college, government medical college is there for every 3 parliamentary constituencies in every state of the country. So it will basically enhance the reach of higher health care to the poor public, especially the poor masses, at affordable rates and within their reach. So this was the government's health budget for the year 2018. This was all for 1st Feb 2018. For more videos, you can visit www.edutap.co.in. Thank you and happy learning.